everyone. I'm Robin Hattersley, Editor-in-Chief of Campus Safety Magazine. Welcome to the show. Security cameras have been installed in healthcare facilities for years now, and they provide a great number of benefits, such as helping hospital security teams investigate incidents, monitor waiting rooms and other areas of concern, and much more. But the applications of video surveillance systems in healthcare have greatly expanded recently, and Access Communications has been on the leading edge of many of these breakthroughs. So today I'm speaking with Paul Baratta, who is Access's Healthcare Segment Development Manager on what's new in video surveillance, particularly in healthcare. In this interview, Paul tells us about some of the non-traditional ways video surveillance can be used to make healthcare facilities not only more safe and secure, but more efficient so clinicians can provide better patient care. Additionally, he tells us how healthcare facilities can address privacy concerns related to video and audio recordings. He also touches on trends related to body-worn cameras and cybersecurity. So with that, here's my interview with Paul. Enjoy the show. So Paul, traditionally we thought of video surveillance as only for security, but it can be applied to a whole host of other things. What are some of the non-traditional ways video surveillance can be used in healthcare?
Thank you, Robin. That's an excellent question. Traditionally we've focused on safety and security, patients, staff, and visitors, assets, and supplies. Another important thing is, of course, is reducing workplace violence. And we had really areas of interest were more like the emergency department, sensitive areas, and behavioral health. But we've morphed into much more as a technology company into patient care, improving the quality of care, telesitting, tele-ICU, integration with the electronic medical record systems, virtual patient observation for family at home, as well as minimizing the spread of infection and reducing the use of PPE by using video, audio, and analytics as really the eyes, the ears, and the brain. And the other thing that helps with, of course, is business and operational efficiencies, where we've been able to take our hardware, such as video and audio, and our analytics to be able to trigger alerts, to bring better efficiencies to like things like HVAC and other devices. So overall, what we're doing is we're making hospitals safer and smarter by providing eyes and ears and a brain. And as we keep developing towards new things like artificial intelligence and deep learning, we're finding that our analytics and our, especially partners like Sound Intelligence that has acoustic analytics, is that we're able to respond to triggers such as medical emergency alarms, coughing incidents, aggressive behavior, and other workplace violence issues.
So what about security and privacy for audio and video? I know there are a lot of concerns about that.
Another great question. So I think the most important thing is when it comes to privacy is that any video that is recorded, and again, I was emphasized that not everyone records a video. They use the telesitting, the tele-ICU, and the patient watch. They use the video, but they don't record it. They just use the video management program as a way to bring those images forward to the nurses or the doctors, but they don't record it. But when they do record it, what's very important is that it's treated as a medical record. So if you're worried about HIPAA compliance, it makes it much simpler. And most video that is recorded in hospitals isn't available to anyone anyways. Most people, I would say all hospitals, will have to have somebody go to risk management. The lawyers will then review the request for the video and then release it. But the way to get around any health privacy laws is by ensuring that the video is treated as a medical record, that privacy is utmost, and that any images or video monitors that have patients are in areas that aren't open to public view. And you can always use privacy screening such as Access Live privacy scan or other ways to ensure that you bring privacy to the patient. One other thing is that many of the cameras have small LED lights or tally lights to observe, so that when the patient who is under observation can can see that the camera is on because the red light is on in the LED light. So that's another way. But most importantly, I guess just to sum it all up is, if you're worried about privacy, just keep those images as medical records and you won't have a problem with privacy.
So, how can video surveillance be used as a force multiplier, not only for security forces, but also for patient staff?
So one of the things that's very interesting about what we've found with our video is that we provide video to medical staff and others, that it helps reduce the amount of time they need to go into a room. They can proactively respond to an event, and if it has an integration with the electronic medical record system, then they're also observing the telemetry and physiological monitors of the patient, along with having eyes and ears to the patient. We have partners that provide mobile carts. We also have our door stations and intercoms that are used in patient rooms. One thing that happened that was very interesting was during COVID, we were asked to assist with setting up these remote patient areas, like in convention centers. And they were trying to figure out, how can we have nurse call and also video to be able to see the patients. And we were able to set up systems using our door stations along with access camera station, and provide a internal system that was being used. And we could add our analytics as well for aggressive behavior, for coughing, and telemetry alarms. So that was one way. And you can see a return on investment when you're looking at patient watches. Mostly security departments have to do one-to-one watches on patients that are wandering, or forensic patients, or someone like that. We are able to use our video, our audio, and our analytics to reduce the amount of patient watch hours. And we've shown already a reduction in costs with many of our partner hospitals, as well as a decrease in violence in the workplace, especially where we've used aggressive behavior, that it's more of a proactive response to those events. And I keep going back to that, and I think it's important, is that what we're doing as a technology company today is we're trying and succeeding in adding eyes, ears, and a brain, in making your security systems, your traditional security systems, more about being a proactive response and thinking ahead. And now that we've added artificial intelligence and deep learning cameras, it's made it much easier.
Now, Paul, what are some of the other new trends in technology you're seeing in healthcare?
So we're actually seeing a big increase in the demand for wearable body-worn solutions. We call them wearable solutions. Traditionally, body-worn cameras were being used in law enforcement. We first started working with our end customers in healthcare using our body-worn or wearable solutions. Wearable surveillance solutions is really the best way to put it, with the security teams. But then as it became more and more acceptable and understanding and seeing, and we've made changes by adding some devices that, like the Cube, which is very unintrusive. It doesn't have the same look as other body-worn cameras where it looks very militaristic or policey. These are just small devices, and clinicians are using them. And in two areas that we've seen where they're being used, in the emergency department and behavioral health, we've actually seen a real decrease in violence, especially in the emergency department, where the clinician will tell the patient or the people that are visiting the patients, in some cases, in other words, visitors that are getting disruptive, they'll actually say, we're turning on a body-worn wearable solution, and we're going to be recording what's going on here. And they've seen a huge decrease in violence. because of that. So it's actually something that we have continued to develop. The advantage of body worn wearable solutions with access is that they're open, so you don't need to buy a evidence program or anything like that. You can put those images and all of that right onto your video management system, which you currently have. Again, it's important to remember about privacy, that anything that is recorded is considered a medical record. And so if you're going to use it for any type of prosecution, you want to make sure that you work closely with your risk management team.
Now, what about the cybersecurity concerns with these solutions?
So cyber is really something that we have taken very serious at Access Communications. It's something that we're constantly looking at. And, it's something in healthcare that's been a major problem, including ransomware. And it's happening all the time. And so there's a few things you can do. One, we have a we have a cyber guide that's available online at access.com. And we also have the ability to have our service team, our advanced teams, our service center help you with that. But I think one of the most important things you need to remember is that you need to protect your passwords. You need to ensure that you check that all the cameras that are on your and audio devices as well, anything that's IP, that you have updated those passwords. You can use something like the device manager that Access has to change those passwords in all your devices. It's very important that you take cyber as a number one concern. I would say one of the biggest issues with cyber is that people don't have good policies and procedures in place, and it's important to ensure that you have good policies and procedures in place to ensure that those devices are secure.
Thank you, Paul.